Hello, this is Khurram and you're watching Optometry with Khurram. And today's topic is about the distance magnification. Imagine you are standing at the bus station and the bus is approaching, but you're unable to see the bus or the bus number clearly. Or imagine you are sitting in the classroom, but you're unable to see anything on the whiteboard. This is how a low vision patient feels. And what is the solution? The solution is the distance magnification. So in this video, we will explore what is actually the distance magnification, how to prescribe the distance magnification, and what are essentially important, low vision aids like telescopes which are prescribed in distance magnification. So first of all, what is actually the distance magnification? In distance magnification, we actually enlarging the faraway objects so low vision patients can see it clearly. Remember one thing, that in low vision, we are not actually improving the vision. What I'm saying? In low vision, we are not actually improving the vision. We are actually rehabilitating the vision, right? We are actually rehabilitating the residual vision. So distance magnification is actually enlarging the objects here, right? It is totally different from the near magnification. In near magnification, we use a formula which is called Kastenbaum's formula, right? We will discuss it in the upcoming videos. So before learning about the distance magnification, you must know about that there are two different visual acuities in low vision patients, right? Number one is the current visual acuity of the low vision patient, right? The current visual acuity of the low vision patient, and the second is the desired visual acuity of the low vision patient. What is the desired? What is the requirement? What is the need of that low vision patient, right? So for example, the current visual acuity of the low vision patient is 6/60, right? And he desires that he needs a visual acuity of 6/12, right? So we have, in that case, we have current visual acuity of the low vision patient, that is 6/60, and in that case we have desired visual acuity of the low vision patient, the need of the patient, that is 6/12. So we will take both denominators. From here we will take 60 and from here we will take 12. Both are the denominators, right? And we will simply divide the denominators, right? 60 over 12, right? And the answer is 5, right? So that patient will need the 5x magnification. In second example, for example, in that case, which is the current visual acuity of the patient, and that is, for example, 6/36, and in that case the desired visual acuity is 6/12. So we will take both denominators and we'll simply divide these two, and the answer will be, the equation will be 36 over 12, right? And 36 over 12, it will be 3x, right? So this 3x required by that patient, right? So this is called the distance magnification, and this is how we can make an equation, and this is how we can conclude that how much magnification our low vision patient needs for the distance. So now let's discuss about the low vision devices which can provide the distance magnification. So first of all, we have some handheld telescopes, like this is a 6x magnification telescope, right? Which can be used by the low vision patient, right? And this is a 4x magnification, a handheld telescope, right? And this is another handheld telescope. So this handheld telescopes can be used by the instant spotting, like you want to spot a sign of a shop, a sign of a bus, a number of the bus, number of the train. So these are handheld telescopes for the distance magnification. And now we have a spectacles mounted telescope as well. So you can simply mount this telescope on the spectacles like this. You find the magnification of the patient, distance magnification, and you simply place this spectacles mounted telescope on the patient's spectacles, and you can wear this like this, and you can maintain or adjust your magnification like this. So we have so many types of the telescope, like we have spectacles mounted, we have handheld, we have bioptic. But remember one thing, this is a punchline, this is a clinical pearl of the distance magnification. For example, we have two different devices in my hand, in my right hand and in my left hand, and consider me as a distant object, right? When you will prescribe a telescope of higher magnification to the patient, right, this higher magnification will reduce the visual field like this, as you can see. When you will enlarge the object, the visual field will get reduced like this. Now, right now, you can see my face clearly, but you cannot see these two objects in my hand, right? The telescope. So we conclude that Whenever we'll increase the higher magnification, whenever we prescribe the higher magnification to the low vision patient, it can reduce the visual field of the patient. So comfort of the patient is very important, right? You can prescribe minimum or less magnification to the patient, but you have to take care of the visual field as well while prescribing the distance magnification to the low vision patient. So distance magnification is all about improving functional vision and restoring independence. Either you are watching a TV, either you are spotting a sign of a shop, either you are watching a bus numbers, or you are in the classroom. It will help you. So that's all for this time. We'll see you in the next low vision videos.